Which of the following bones is not part of the carpus? A. Scaphoid. B. Lunate. C. Pisiform. D. Capitate. Answer: E. Radius. Explanation: the radius is a long bone of the forearm but is not part of the carpus. The carpal bones consist of 8 bones: scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. Which carpal bone is most commonly fractured? A. Pisiform. B. Lunate. C. Scaphoid. D. Triquetrum. Answer: C. Scaphoid. Explanation: the scaphoid bone is the most commonly fractured carpal bone, especially in falls on an outstretched hand. It is located on the thumb side of the wrist and has a poor blood supply, which can complicate healing. Which carpal bone articulates with the radius to form the wrist joint? A. Pisiform. B. Scaphoid. C. Capitate. D. Lunate. Answer: B. Scaphoid. Explanation: the scaphoid bone articulates with the radius to form the wrist joint, specifically at the radiocarpal joint. The scaphoid is the first carpal bone in the proximal row of the carpus. The anatomical snuff box is located over which carpal bone? A. Pisiform. B. Scaphoid. C. Lunate. D. Trapezium. Answer: B. Scaphoid. Explanation: the anatomical snuff box is a depression on the lateral side of the wrist, located over the scaphoid and trapezium bones. It is clinically significant for palpating the scaphoid in cases of wrist injuries. The pisiform bone is part of which carpal row? A. Proximal row. B. Distal row. C. It is not part of either row. Answer: A. Proximal row. Explanation: the pisiform is part of the proximal row of carpal bones. It is located on the medial side of the wrist and is a sesamoid bone that articulates with the triquetrum. Which of the following carpal bones does not articulate with the radius or ulna? A. Lunate. B. Pisiform. C. Scaphoid. D. Trapezium. Answer: B. Pisiform. Explanation: the pisiform bone does not directly articulate with the radius or ulna. It is part of the proximal row of carpal bones and articulates only with the triquetrum. Which carpal bone is located in the distal row and is the largest of the carpal bones? A. Capitate. B. Lunate. C. Pisiform. D. Trapezium. Answer: A. Capitate. Explanation: the capitate is the largest carpal bone and is located in the distal row of the carpus. It articulates with several bones, including the scaphoid, lunate, and trapezoid. The hamate bone has a distinct bony prominence called the hook of the hamate. What is its clinical significance? A. It serves as a point of attachment for the flexor retinaculum. B. It is the most frequently fractured carpal bone. C. It serves as a point of attachment for the extensor retinaculum. D. It allows articulation with the ulna. Answer: A. It serves as a point of attachment for the flexor retinaculum. Explanation: the hook of the hamate serves as an attachment point for the flexor retinaculum, a band of connective tissue that helps form the carpal tunnel. The carpal tunnel is important in the context of carpal tunnel syndrome. Which of the following is the correct arrangement of carpal bones in the proximal row from lateral to medial? A. Scaphoid, lunate, pisiform, triquetrum. B. Pisiform, scaphoid, lunate, triquetrum. C. Scaphoid, triquetrum, pisiform, lunate. D. Lunate, scaphoid, pisiform, triquetrum. Answer: A. Scaphoid, lunate, pisiform, triquetrum. Explanation: the correct lateral to medial arrangement of carpal bones in the proximal row is scaphoid, lunate, triquetrum, pisiform. Which of the following is the primary function of the carpal bones? A. Support weight of the upper body. B. Protect the brain. C. Facilitate wrist movement. D. Provide attachment points for upper limb muscles. Answer: C. Facilitate wrist movement. Explanation: The primary function of the carpal bones is to facilitate the wide range of wrist movements, such as flexion, extension, radial deviation, and ulnar deviation, by forming joints with each other and with the radius. The lunate bone is most commonly associated with which type of injury? A. Fracture. B. Dislocation. C. Sprain. D. Carpal tunnel syndrome. Answer: B. Dislocation. Explanation: the lunate bone is the most commonly dislocated carpal bone, often due to falls or trauma. Lunate dislocations can lead to significant wrist dysfunction and are often associated with carpal tunnel syndrome. The trapezium carpal bone articulates with which of the following structures? A. The ulna. B. The third metacarpal. C. The first metacarpal. D. The radius. Answer: C. The first metacarpal. Explanation: the trapezium articulates with the first metacarpal to form the carpometacarpal joint of the thumb, allowing for the thumb's wide range of motion, including opposition. What is the primary function of the carpal tunnel? A. Protects the radial artery. B. Allows passage of tendons and the median nerve. C. Provides stability to the wrist joint. D. Serves as an attachment point for ligaments. Answer: B. Allows passage of tendons and the median nerve. Explanation: the carpal tunnel is a narrow passageway in the wrist, formed by the carpal bones and the flexor retinaculum, through which the tendons of the flexor muscles and the median nerve pass. Compression of this tunnel can lead to carpal tunnel syndrome. Which of the following statements is true regarding the carpal bone's blood supply? A. The carpal bones have a rich blood supply that allows for rapid healing. B. The scaphoid has a poor blood supply, which can complicate healing after fractures. C. The pisiform has the best blood supply of all the carpal bones. D. The lunate bone is avascular and unable to heal once injured. Answer: B. The scaphoid has a poor blood supply, which can complicate healing after fractures. Explanation: the scaphoid has a relatively poor blood supply, which can complicate the healing process if fractured, leading to potential avascular necrosis. What is the typical position of the pisiform bone in relation to the other carpal bones? A. It is located distally and laterally. B. It is located proximally and medially. C. It is located laterally and centrally. D. It is located distally and centrally. Answer: B. It is located proximally and medially. Explanation: the pisiform is located proximally and medially in the wrist, in the proximal row of carpal bones. It is a sesamoid bone that articulates only with the triquetrum. Which carpal bone is the most central in the wrist, articulating with both the scaphoid and lunate bones? A. Capitate. B. Pisiform. C. Trapezium. D. Trapezoid. Answer: A. Capitate. Explanation: the capitate is the most central carpal bone and articulates with the scaphoid and lunate bones in the proximal row, as well as the trapezoid in the distal row. It is the largest carpal bone and serves as a key stabilizer in wrist movement. Which of the following carpal bones articulates with the second metacarpal? A. Pisiform. B. Trapezium. C. Trapezoid. D. Scaphoid. Answer: C. Trapezoid. Explanation: the trapezoid articulates with the second metacarpal bone, forming the carpometacarpal joint of the index finger. It is located in the distal row of carpal bones. A patient presents with a palpable bump on the dorsal wrist following a fall. Which of the following injuries is most likely? A. Scaphoid fracture. B. Lunate dislocation. C. Carpal tunnel syndrome. D. Pisiform fracture. Answer: A. Scaphoid fracture. Explanation: a palpable bump on the dorsal wrist following a fall is most commonly associated with a scaphoid fracture. This injury is often caused by falls on an outstretched hand and can be challenging to diagnose, requiring careful imaging. Which of the following ligaments is responsible for maintaining the stability of the carpal bones during wrist movement? A. Flexor retinaculum. B. Transverse carpal ligament. C. Extensor retinaculum. D. Ulnar collateral ligament. Answer, B. Transverse carpal ligament. Explanation: the transverse carpal ligament, also known as the flexor retinaculum, helps maintain the stability of the carpal bones and serves as a roof over the carpal tunnel, which contains the tendons and median nerve. Which of the following carpal bones is most likely to be affected in a patient with Kienbeck's disease? A. Pisiform. B. Scaphoid. C. Lunate. D. Trapezium. Answer, C. Lunate. Explanation: Kienbeck's disease is a condition characterized by avascular necrosis of the lunate bone, leading to wrist pain and dysfunction. The cause is often related to trauma, but the exact mechanism of blood supply disruption is still not fully understood.